In this session, we will be discussing about liver cirrhosis. As an introduction, liver cirrhosis is actually a diffuse process. That is, the entire lobe of the liver is affected, and it is characterized by fibrosis and the conversion of normal architecture into regenerating nodules. So we have to memorize three important points. There is fibrosis, there is appearance of regenerating nodules, and it is a diffuse process that involves the entire liver. Talking about the etiology, liver cirrhosis is the end stage of any chronic liver disease. Major causes includes excessive drinking of alcohol, then infections, that is hepatitis B and hepatitis C infection, and fatty liver, which is caused due to obesity or diabetes. These are some of the etiological factors. Now let's discuss about the pathogenesis. I have made this new one because it will be easier to digest. So if any of these etiological factors come into effect, this damages the hepatocytes. This damaged hepatocytes produces reactive oxygen species as well as DAMs, that is damage associated molecules. Both of these can activate the stellate cells as well as the Kupffer cells that is present within the liver. And once they are activated, they produce cytokines like TNF, that is tumor necrosis factor, and TGF, that is transforming growth factor. So this transforming growth factor transforms and activates stellate cells to form myofibroblast. From this myofibroblast, collagen is formed, which results in fibrosis. And from this TNF, it causes, that is tumor necrosis factor, it causes inflammation, which results in necrosis, which is the cause for the formation of nodular formation, that is it causes nodular formation. So just repeating once again, once these etiological factors come, results in damage of the hepatocytes, they produces reactive oxygen species as well as damage associated molecules, which results in the activation of Kupffer cells and stellate cells. This produces cytokines, results in their activation, results in fibrosis as well as results in formation of nodules, that is regenerating nodules. Now let's discuss about the classification of liver cirrhosis. It is mainly classified into two sections. The first one is the morphological classification and the second one is etiological classification. The morphological classification is based on the size of the regenerating nodules, and based on this, morphologically it is classified into three types, that is micronodular cirrhosis, macronodular cirrhosis, and mixed cirrhosis. From the name itself, it is clear that the micronodules, that is the nodules, are smaller in size. So these nodules are less than 3 mm in size. These are regular in shape and the fibrous septa is thin. Now talking about the macronodular cirrhosis, the nodules are greater than 3 mm in size and these are irregular in shape and the fibrous septa is broad. Now about mixed cirrhosis, it contains both micronodules as well as macronodules. Talking about the etiological classification, this mainly includes the causes of the liver cirrhosis, that is alcohol, viral hepatitis, drugs and toxins, non-alcoholic liver diseases, etc. Now let's look at the morphology of liver cirrhosis. Talking about the growth, we can actually divide it into two stages, that is the early stage and the late stage. In the early stage, the liver becomes fatty. As a result, it appears to be a yellow tan in color and the size is enlarged. But in the late stage, it changes. That is, the liver becomes non-fatty. As a result, the color becomes brown and it becomes small and shrunken. And on the surface, we can see the nodules. The nodules will first appear small, that is, they will be less than 3 mm in size. That is, first they form the micronodules. Then progressively, when they coalesce to form larger, they forms macronodules, and there, on the surface we can see mixed nodules, that is both micronodules and macronodules can be seen on the surface of the liver. Now we'll be moving on to the microscopy. Regarding microscopy, we have to write four important points. You must write these four important points. The first one is loss of architecture. Second one is regenerating nodules. Third one is fibrosis. And the fourth one is vascular reorganization. Talking about the loss of architecture, due to the hepatocyte injury and due to all this fibrosis and all, the entire architecture of the liver is lost. Talking about the regenerating nodules, we have already discussed about the nodules. That is, first they forms micronodules, then they form macronodules, and finally there will be mixed nodules. That is, both micronodules as well as macronodules can be seen on the surface of liver. Talking about the fibrosis, it is initially delicate and extends through the sinusoids from central to portal regions as well as from portal tract to portal tract. This later becomes broad bands. Talking about the vascular reorganization, due to this fibrosis and parenchymal damage, the vascular architecture of the liver is lost. As a result, new vessel channels will be formed. That is vascular reorganization. Now, let's talk about the clinical features. In the initial phase, that is a compensated cirrhosis, the patient may be asymptomatic. But in the later phase, that is the decompensated phase, the patient shows complaints of both portal hypertension or liver dysfunction or both. And some of the non-specific clinical manifestations includes anorexia, weight loss, and weakness, etc. Talking about the complications, the main three complications includes portal hypertension, the second one is liver failure, and the third one is hepatocellular carcinoma. This portal hypertension can lead to the following. That is, it can lead to ascites. It also lead to the formation of portosystemic venous shunts. It causes congestive splenomegaly, and it causes hepatic encephalopathy. Some of the endocrine complications that are associated with cirrhosis. In men, it causes hyperestrogenism. That is, because of the liver failure, there is reduced hepatic catabolism of estrogens and weak androgens are converted to estrogenic compounds. As a result, it leads to feminization in men. It also leads to gynecomastia in men. The second feature in men is hypogonadism. That is, there will be testicular atrophy and impotence and loss of libido. In case of females, it leads to gonadal failure. Talking about other complications, it includes pruritus. That is, chronic severe jaundice can cause itching, severe itching. That is pruritus. And the causes of death in case of cirrhosis includes hepatic encephalopathy, bleeding from esophageal varices. That's all for today. Thank you and have a nice day.